Fresh leadership at the Oregon State Hospital as the standing of the Salem facility hangs in the balance. It's 5 o'clock. I'm Todd Unger.
I'm Jeff Gianola, and the governor announcing the resignation of the former interim superintendent late on Friday. Her office appointing a new acting superintendent following the sudden death of a patient last month. Joel Jones joins us. I know you've asked tough questions of the governor and the Oregon Health Authority.
I have been asking. The governor's office says that this shakeup is due to additional information Kotek received about that patient's death. I asked what those details were and how it informed her decision, but right now her office isn't saying anything outside of what was released late Friday.
Something needed to happen, but I'm not sure it needed to be Dr. Walker.
Mental health advocates react to the resignation of former interim superintendent Dr. Sarah Walker. Governor Tina Kotek appointing Dave Baden, Deputy Director of Policy and Programs at the Oregon Health Authority, in charge. This comes as national healthcare regulators preliminarily stripped the Salem Psychiatric Hospital's accreditation in March, citing conditions that could pose a threat to patients.
The state has put in enormous amounts of money to build a hospital that was safe and training for staff to be safe. They have fairly good leadership at this point, but it seems that there's still something wrong and we don't know what it is.
A survey by the Joint Commission found OHA failed to offer a safe environment for a patient in seclusion, provided inadequate assessment and slow emergency medical response, calling staff to be retrained on how to respond to falls, among other improvements.
It's certainly one of the many needles that broke the camel's back.
Jason Renaud with the Mental Health Association of Portland says it's no secret the Salem facility has been riddled with troubles, citing a 20-year lawsuit with Disability Rights Oregon, the hospital's ongoing struggle to comply with court orders and find patients outgoing placements.
That is the key problem, moving people out of the state hospital. Clinically, the hospital is in pretty good standing right now, with the exception of these mysterious deaths.
According to OHA, 21 patients have died at the Oregon State Hospital since 2020, 9 of which were unexpected.
There should be 0 unexpected deaths at a state hospital with clinical supervision this tight.
And a follow-up survey by that Joint Commission is slated for Thursday to determine what progress has been made. In the meantime, OHA tells me hospital staff and leadership are working under the new acting superintendent to craft a 30-day plan around patient care and safety. You can read his statement at KOIN.com.
And it'll be interesting to see how much more information they do release about what led to that resignation.
You're right, Jeff. Pretty tight-lipped right now, so we'll have to see.
All right, Joelle, as always, thank you.